Hello everyone, welcome to the Everyday Life channel. In today's video, we will conduct an in-depth analysis of 5 common food groups that easily contribute to blood clot formation, the disease mechanisms, medical evidence, specific dietary changes to reduce risk, and early warning signs you must not ignore. This article provides practical knowledge that is easy to apply for the whole family, especially important for middle-aged people, those with hypertension, lipid disorders, or a history of cardiovascular disease. A blood clot is a mass of blood that forms inside blood vessels when the hemostasis mechanism is excessively activated or when the vascular endothelium is damaged. When a clot stays in place, thrombus, or breaks off and moves, embolus, disease. If it blocks blood vessels supplying the brain, it causes cerebral infarction, a type of ischemic stroke. There are 3 basic factors leading to thrombosis, according to Virchow's triad: vascular endothelial injury, inflammation, abrasion, oxidation; abnormal blood flow, slow, turbulent, for example, due to unstable blood pressure, atrial fibrillation; hypercoagulability, increased platelets, changes in coagulation system. Food and eating habits directly affect all 3 factors: altering vessel wall structure, activating inflammation, increasing bad cholesterol, triglycerides, disrupting blood viscosity, or changing platelet activity. Therefore, besides traditional fatty meats, many other familiar foods are also accomplices in the thrombosis process. 5. Food groups to avoid limit because they easily promote blood clot formation. 1. Animal offal, brain, liver, intestines, heart, glands. Mechanism: offal contains a lot of cholesterol, sometimes saturated fatty acids and purines. Although recent evidence shows the relationship between dietary cholesterol and blood cholesterol is complex, for people with lipid disorders or coronary artery disease, frequent consumption of offal can increase LDL, triglycerides, and promote atherosclerosis, the foundation for endothelial damage and clot formation. Examples: liver, pig intestines, pig brain, chicken heart. Recommendation: if you have high cholesterol or a history of heart disease, limit offal to very little, e.g., a few times a month or less. Replace with less saturated protein sources: fatty fish, skinless chicken breast, beans, nuts. 2. Red meat and especially processed meats: sausages, ham, smoked meat. Mechanism: red meat is rich in saturated fat. Processed meats contain nitrites, nitrates, salt, and compounds formed during smoking. These substances are linked to chronic inflammation, hypertension, endothelial dysfunction, and increased atherosclerosis risk. Additionally, high salt content raises blood pressure, a strong risk factor for stroke. Examples: sausages, ham, bacon, canned meat, cold cuts. Recommendation: strongly reduce consumption. Limit to a few dozen grams per week if any. Prioritize fresh meat, remove fat. Increase fish and plant protein intake. Limit processed foods. 3. Alcoholic beverages, specifically excessive drinking and binge drinking. Mechanism: excessive alcohol damages the endothelium, raises blood pressure, increases triglycerides, and can cause atrial fibrillation, which is a source of clots traveling to the brain, causing cerebral infarction. Binge drinking, drinking heavily in a short time, is particularly associated with stroke in young people. Examples: heavy drinking over consecutive days, going all out at parties. Recommendation: women no more than 1 unit per day, men no more than 2 units day, and ideally minimize excessive drinking. If you have cardiovascular disease, hypertension, atrial fibrillation, or stroke history, consult a doctor before drinking. 4. Fried foods and foods containing trans fats. Mechanism: reused frying oils and industrial fried foods often contain trans fats and lipid oxidation products. Trans fats increase LDL and decrease HDL, promote endothelial inflammation, and increase platelet aggregation. all raising thrombosis risk. Examples: industrial French fries, fried chicken, industrial pastries, repeatedly fried fast food. Recommendation: avoid trans fats as much as possible. Replace reused frying oils with baking, steaming, or light pan frying. Prioritize olive oil, used cold or lightly pan-fried, non-hydrogenated sunflower oil, and eat less fried food. 5. Foods and drinks high in sugar, soft drinks, milk tea, sweets. Mechanism: refined sugar increases triglycerides, causes insulin resistance, systemic inflammation, and produces advanced glycation end products, AGEs, that damage vascular endothelium and promote atherosclerosis. Studies show frequent consumption of sugary drinks is linked to increased cardiovascular disease and stroke risk. Examples: soft drinks, sugary fruit juices, milk tea, cakes, candy. Recommendation: minimize sugary drinks. If sweetness is needed, prefer fresh fruit or unsweetened drinks. Check labels and avoid products with high added sugar. Quantity and frequency. How to eat safely. Offal and processed red meat. Eat very little, ideally a few times per month, or replace entirely with other protein sources if you have lipid disorders. Fried foods, trans fats. Avoid completely when possible. Laws and medical guidelines recommend minimizing trans fats. Next, alcohol. If drinking, do not abuse. Avoid binge drinking. Heart patients should consult doctors. Sugar. No more than 25 to 36 g added sugar per day, depending on country guidelines. Ideally less than 1 serving of sugary drinks per week. These numbers are for reference. Individualize according to health status. 6. Early warning signs of cerebral infarction. Early detection can save lives. When stroke is suspected, time is brain. Every minute lost means millions of neurons damaged. Remember these signs, expanded from the International FAST criteria, plus additional warning signs. 1. Weakness/numbness on one side of the face or body, drooping face, weak limbs, inability to smile evenly, inability to raise both arms. 2. Speech disorder, difficulty speaking, repetitive speech, inability to understand others. 3. Sudden vision loss or blurred vision on one side, double vision. 4. Dizziness, loss of balance, poor coordination, or sudden falls. 5. Sudden severe headache, completely different from before. Excessive fatigue, continuous yawning, or unusual drowsiness, along with the above signs. Some patients may have a warning feeling of brain oxygen deficiency, e.g., frequent yawning, but this sign is nonspecific, so be alert if it appears with other symptoms. If you notice any of the above signs, call emergency services immediately. In Vietnam, emergency number is 115. Or take the patient to the nearest medical facility as soon as possible. Remember, do not give food or drink if the patient has difficulty swallowing. Try to note the symptom onset time to inform medical staff, as some emergency interventions, like thrombolytic therapy, have time limits. Practical prevention measures. Diet plus lifestyle. 1. Diet. Follow the Mediterranean style. Lots of vegetables, fruits, whole grains, olive oil, fatty fish, omega-3, nuts, beans. Reduce butter, offal, red meat, and processed foods. 2. Control risk factors. Blood pressure, blood sugar, lipids, weight. Regular checkups and adherence to prescribed medications. 3. Exercise regularly. At least 150 minutes of moderate physical activity per week or 75 minutes of vigorous activity. 4. Quit smoking and limit alcohol. Smoking damages endothelium, increases platelet aggregation. Excessive alcohol increases stroke risk. 5. Reduce stress and get enough sleep. Insomnia and chronic stress affect blood pressure and systemic inflammation. 6. Discuss preventive medications with your doctor. For patients with atrial fibrillation, valve stenosis, history of embolism, Doctors may prescribe anticoagulants or antiplatelet drugs. Do not take aspirin or anticoagulants without medical advice. Smart alternative menu. Example, 1 sample day. Breakfast, oatmeal porridge plus fresh fruit plus 1 spoon of chia seeds. Lunch, steamed or grilled fish, salmon, mackerel, mild fish, plus brown rice, plus lots of green vegetables. Afternoon snack, 1 apple or 1 cup of unsweetened yogurt. Dinner, lentil salad plus skinless chicken breast or tofu plus steamed vegetables. Avoid sugary drinks, fried foods, processed foods. Final note, when to see a doctor immediately. If you have risk factors, hypertension, diabetes, lipid disorders, smoking, and develop the above signs. If someone in your family has had a stroke, regular health checks are needed to adjust medications and diet. Daily food greatly affects vascular health. Not only fatty meat is the enemy. Offal, processed meats, fried foods containing trans fats, excessive alcohol, and sugary foods can all contribute to thick blood, endothelial damage, and increased thrombosis risk, leading to cerebral infarction. Gradual changes, reducing processed foods, increasing fruits and vegetables, regular exercise, and controlling risk factors can significantly reduce this risk. Thank you for watching. If you find this content useful, please like, subscribe to the Everyday Life channel, and turn on notifications so you don't miss upcoming videos/articles about family health, smart eating tips, and root cause disease prevention. Medical disclaimer. This video is for informational and educational purposes only and does not replace diagnosis or medical advice. If stroke is suspected or acute symptoms occur, call emergency number 159 in Vietnam or go to the nearest hospital immediately.